Welcome to the Talking HealthTech podcast. My name is Peter Birch. Today I'm joined by Vince Farrell from Nuvo Health and Melvin, Chen, CEO and co-founder of CareGP. Today we're looking at the weight of admin and other pressures that are facing general practitioners. We've got the rising costs and burnout and mountains of paperwork that are slowing everything down. We talk about those issues a lot on this podcast. So I'm chatting with Vince and Melvin today, and they've teamed up to tackle the admin burden head on using artificial intelligence. We'll dig into how their virtual assistant, Samantha, is helping GP clinics, starting with the document processing side and what it's like rolling out technology in the real world. Melvin, Vince, thanks so much for joining today.
Thanks, Pete.
Thank you.
Hey, Melvin, great to have you on the podcast again. Last time we spoke, we were in a picturesque location with two iconic Sydney landmarks in frame. And, we got to learn a little bit more about your background and how you've been looking at healthcare across the globe and then into Australia and the role that technology plays in addressing specific issues. And I know you're a doing kind of guy and really focused. When you're focused on a particular problem, you go all in. It seems like you're really honing in on this problem of admin burden for GP clinics. Why this particular problem right now? And tell me more about it.
Pete, I think last time we spoke, this is Q1 of 2024, and we were talking more about hospitals and AI agents in the context of healthcare and hospitals. We're actually looking at voice, but then what got me thinking was really discussions with customers, and I had many discussions with GP clinics, specialist clinics, and other segments of healthcare. And when I spoke with them, I actually realized that there's just as much of a pain point, or even more of a pain point, for these subscale, some of these smaller types of healthcare providers. And it was really just leaning into listening to their problem statements, what actually matters for them, that got us onto looking at this document allocation or document processing, where you have receptionists or admin staff having to manually do data entry, and that's eating up a lot of their time and attention. And so we focused and oriented on that as a problem that really mattered and for the customers.
Yeah. Look, it's great to have Vince on this conversation too. I'd love to learn, tell us a little bit more about Nuvo Health, and maybe, as Melvin was alluding to, and I know firsthand too, GP world, there's a lot of admin that goes around the actual doing of being a GP. I'm not sure as a percentage of your total day you're actually doing GP tasks versus all the other stuff that's necessary. It's important, but geez, it can be a burden. Tell me a bit more about Nuvo Health.
Sure, Pete. So Nuvo Health is mostly a general practice focused medical group based in Sydney. We've got 18 clinics altogether now, so 15 GP clinics and 3 specialist clinics. So we've just started to move a little bit into the specialist world, but I've started off as GP back in 2011. I guess there's two aspects to admin in general practice. There's the admin associated with the clinical side. And then there's the admin associated, with the day-to-day running of the practice, the back end, that our reception staff and practice managers deal with. And, I guess they're two very separate problems. And, I think there's been a lot of attention given to, how GPs' lives can be made easier, in the past 6 to 12 months with, AI agents for consult notes coming into play. But there hasn't been a lot of focus on the administrative side of general practice, or at least not as much of a focus with the potential that technology can offer in the modern day. So my job as the operations manager is very much looking at, where we can scale efficiencies within the medical centres, and effectively how we can make our team's life easier. As you mentioned, the rising costs of running a practice is certainly an ongoing problem for the industry, and not one that I see going away anytime soon. And there's been some, I guess, fantastic evolutions in the last 5 to 6 years in, how things run in a general practice. We've got COVID to thank for that, of course. I don't think we'd probably see, things like e-prescribing or, video consultations being, freely offered now if any of that didn't occur. But I guess, there's a lot more steps that can be taken in this space, and some of those extra features have generated a lot more work for the admin teams on the ground, because whilst it offers fantastic convenience to patients, it offers complexity in terms of workflows on the ground as well. So I guess this, our collaboration with CareGP is really about looking at what opportunities are there for us to make our team's life easier. At the end of the day, improving our retention, making the business more sustainable, and I guess long-term goals, changing the face of admin in healthcare.
Yeah, definitely, and you raise a good point. I think just in passing there that the there's definitely increasing expectations and requirements on a general practice clinic in delivering all of these important things for patients. And they're technically all possible to do, but it just brings more cost, right? Like you could increase the number of receptionists that you have in theory by double or triple if you wanted to, but there's not really a environment in GP land at the moment where you could then also double or increase triple the cost of a consultation. So that's really a constraint. There's more things to do, and you've got to kind of use the same amount of people, if not less, to be able to do those things. And hopefully from the patient's front end, it either feels the same, if not better. But then behind the scenes, you kind of need to look at, well, let's reinvent what this actually looks like. I'd love to hear from you a little bit more about, I guess, or maybe even see from you as well, what the process looks like, prior, and then what the process looks like after implementing some of these cool new tools. And for those on the audio podcast, you'll have to jump over to talkinghealthtech.com/podcast, and you can view this episode, or you can jump onto YouTube and check it out there.
All right. So this is a quick example of what our existing workflow looks like for filing documents into patient records. So all incoming correspondence that arrive at the clinic, whether they be by fax, hard copy mail, email, there's so many different channels for things being sent to us in this day and age. And unfortunately, whilst a lot of the industry is trying to move towards secure messaging platforms such as HealthLink for transferring information, there are a lot of gaps in terms of that happening, and there's still a huge reliance on faxes, being sent and received by medical centres, unfortunately. So this tool is very much designed to help address some of those challenges and streamline the process of managing and allocating incoming documents as they come into the clinic. So I'll just give you a quick view of what our existing workflow would look like. So on the left here, you will see a still shot of the bulk document import tool that we use with our PMS software best practice. And you'll see here, there is a preview of a document which I'm looking to import and allocate to a doctor in the system. So in order to complete that process, I need to select, is it going to a specific doctor, or is it being allocated directly into the patient file? I need to manually search for the patient in the database that matches the name of the document, of course. I need to select and enter the date of the document. I need to label the document with a subject. I need to enter the contact, who is the author of the document. I need to select where I'm going to be filing this information into the patient file, whether it's an investigation or just a standard correspondence. I need to select which doctor the document gets allocated to and the document category. So naturally, when we've got a large clinic, or 15 clinics perhaps, where we're probably receiving anywhere from 20 to 60 hard copy documents per day, or documents that need to be filed in some respect into the PMS software. it's very time consuming. So probably each document takes anywhere between 1 to 2 minutes to file by the time you've double checked you're, not getting the patient name or date of birth wrong. It is, I guess, a high risk area. So you do need to make sure that your information is correct before proceeding. And yeah, there was definitely a need, and this is one of the first issues that I'd highlighted to Melvin, that practices are swimming in this kind of admin, and it's unfortunate because it's a sort of admin that patients don't benefit from whatsoever. You're taking time and focus away from the patient sitting in front of you, or on the phone with you, to be getting this sort of work done, either in the back room or even behind the front desk, where the receptionist looking at the screen instead of being able to give the patients the attention they need. So that was the problem, and the solution here is on the right. So you'll see here, we've obviously taken, I guess, the format that Best Practice offers with their bulk document import tool and tried to keep that as consistent as possible, just so that users are familiar with what's being put in front of them, and hopefully just help them warm to the tool a little bit quicker. So I'll show an example. We've prepared a batch of demo documents, which I'm just going to upload here. Just to note also, all of these documents have, of course, been de-identified for privacy purposes. So whilst they are real documents, both the practitioner names and the patient details and any numerical identifiers have, of course, been removed from the document. So just waiting for that one to wrap up. Okay, so basically once the tool has imported each of the documents, you'll have a list of all the documents on the left here, of course the document preview, and the individual document information on the far right here. So you'll see a status column here, the blue icon saying ready, and a couple that say check. So this just basically gives you an indication off the bat of how successful the document tool has interpreted the information on the document, and whether or not it's been successful in allocating each and every field to allow the document to automatically import these into the patient file without any concerns of accuracy. So I'll take you through a couple of these documents. So the first one here, we can see this one's been marked as ready. We've had all of this information pre-populated. So the patient name, the date of the document, the subject of the document, the author of the document, the storing location and best practice, the doctor it's to be allocated to, and the document category. And you'll see here, we have highlighted where the AI has picked up all of these individual fields from in the document. So a receptionist can easily, if there was ever any concern, particularly in the early days of using the tool, where they might just want to double check that the information Samantha is giving is correct, they can quickly refer back and see, okay, where did the date come from? Where did the patient name come from? So this one obviously has done very well, and I have no concerns with it. I'm not going to import this one just because I want to be able to demonstrate the auto import tool shortly. We'll just have a look at one other document. So you can see here, this is another one marked as ready. The tool, I guess, has been crafted to take into account various different document formats, especially ones relevant to general practice. So again, faxes are a big thing, so they know to kind of ignore fax cover sheets to not throw off the identification of the fields on the actual document that usually comes after the cover letter. So again, completely fine with this one. So the way that we'd use this tool is basically all of the ones that are marked as ready, we are generally going to be happy to use the auto bulk import tool, which again, instead of spending 1 minute to 2 minutes on each document, you've basically turned this into a 1 to 2 minute job to import all 12 of those documents that I've got in the demo here. So when you select auto bulk import, it'll confirm, do you want to put in the do you want to allocate these to a doctor, or do you want to put these directly into a patient file? Of course, these ones we do want to actually go into a doctor's inbox for marking before it lands in the patient file. So if I select confirm and import, it's just going to quickly start running through that list of documents. You'll see them disappear from your list. And then you will only be left with 3 variables, which are the 3 that are marked as check here. So I'm just going to click on one of these that's marked as check. So you'll see on the top right, it'll indicate why the document wasn't able to be auto imported. And in this case, date of birth not found on document. And reviewing this document, that is in fact correct. So with some work cover invoices, there won't be dates of birth listed on the document. That's always a bit of a pain point for us. So in this case, it's obviously found the patient name and it's been able to identify every other part of the document. It's just wanting the user to confirm, hey, we couldn't find the date of birth. Can you just confirm this matches up with the patient we've selected? So you'll see here, it has still given us a suggestion from the best practice database and that patient's date of birth. So in this case, I'm happy to look at this and say, yep, that is actually the correct patient. And I'm just happy to import this one as a single document. Looking at this one, so this one hasn't been able to find a user to allocate the document to, which again is correct. This is a common problem in general practice. If a GP is CC'd in a document, they will often not be listed on the document. It might just be forwarded to them from another provider, in which case their details won't be present on the document to be identified. Now, in this case, we've built a failsafe for this. So you can see here in the user list for best practice, we are able to identify who the latest GP the patient saw was, and also the most, the doctor that has the highest volume of consults for that patient. So normally a receptionist would have to go into the patient file, have a look at the billing history or the visit history to see, who was the last GP they saw, who's their regular GP. But basically this information just comes into the user list here. So it prevents them having to go back into the PMS and confirming that information. So in this case, I'd be happy to allocate this to Sally, knowing that she was the most recent GP that the patient saw. And lucky last here, this is another date of birth mismatch. So this one here, looking at the date of birth, the author of this document has come up with a very artificial date of birth, being the 31st of November, which of course does not exist in this day and age. So that's obviously a mistype in the document itself. But again, the system on our end has been able to identify a patient in the database with the same first and last name and provided a suggestion with a very similar date of birth. So we can assume that there's just been a typo in the construction of this letter at some stage, and I'd be happy to import that one. The tool is also very adept with managing handwritten documents. This is, again, a large challenge of general practice is that, you've got, more mature cohorts of patients that, aren't going to be as techie, will still want to handwrite things, fill out consent forms, new patient forms. So the ability to interpret the, handwritten text is very important, and the OCR with CareGP is quite strong in this regard as well. So that's the basic demo. There's a couple of additional features we've put in as well, which again, users can select based on how they want to be using the tool. So we've got the ability to change cross-checking filters. So before, as you saw, it was checking date of birth and first name, last name. You can increase and decrease those cross-checks based on how you want to be using the tool. So that, it's really been built, I guess, for the diversity that exists in general practice. You have different levels of risk, different attitudes towards technology, but we feel that this, really gives users the choice of whether they want to fully automate something like this or whether they want to make use of it, but, still be checking each document individually. And again, that just comes down to offering different ways of using technology. So that's pretty much the summary, Pete.
I feel like that's going to be an important part to, I guess, the general adoption of artificial intelligence across any industry, but particularly healthcare, is the option for the humans to choose to dial up or dial down how much involvement they have in the process, because there's obviously a lot of intuitive elements that you can provide, and that builds that trust and I guess ongoing adoption of a tool. And like you say, it might start off as quite a hands-on approach towards doing things, but as you start to realize some patterns and things, then you can dial that out appropriately. That's been really helpful to see that in motion in real time. I appreciate you sharing that, Vince. I'm also keen to learn from you too in terms of like using it in practice. I guess that demonstration really provided that clarity around how simple it is. How have you found? Is there anything that surprised you in terms of the implementation of it in the real world? And look, it's great to be able to see it in a demonstration, but then it hits the kind of real patients, and then knock-on tracks. What's it been like implementing in the real world? The response from clinicians, admin staff, or even if there's feedback from patients?
Yeah, well, the feedback is very much with practitioners and the admin staff on our end. So again, this is really a back-end process that in an ideal world, it shouldn't affect patients at all. It only really affects patients if there's an issue with it. So, if you're filing documents into the wrong patient file and maybe the doctor calls the wrong patient thinking that a document's related to them when it isn't, and that sort of thing does happen. As much as I think every general practice does their absolute best to prevent errors like that from occurring. Again, just the weight of admin means that you can't spend as much time cross-checking this sort of thing as you once could. So there's a real need for that, automation and just that additional help to streamline the process. So I guess from our admin staff, again, there's so much that our team needs to do on a day-to-day basis, and you want their time to be spent, doing the things which are clinically important. So, helping the GPs manage their recall lists. So when there's a result that comes in, being able to call a patient back to review those results in a timely manner. Those are the things that you want your staff to be spending time with, not spending time doing documents, and you want them to be able to pick up the phone and give patients their full attention. And that's definitely been the feedback so far, is that the time save on this, again, when we're looking at 40 documents per day, that's almost an hour, like more than an hour of their time actually that's already been saved at a single practice. And again, scaling that across 15 practices for us, obviously that's a no-brainer, because it's 15 hours a day where our staff are spending time doing more important admin, as opposed to the back end stuff that doesn't actually impact patients. We've only had a small sample so far in terms of GP feedback on it, but what we've seen so far is that I guess the accuracy of the tool has been probably superior to even the human identification at this point. Which, to be honest, that's the bit which really surprised me. I guess if you had asked me 12 months ago whether or not that was even possible with a document import tool, I would have been very skeptical, and Melvin knows that I was very skeptical in the early days of these conversations. But yeah, I think in the entire, and we've tested hundreds of documents at this stage in different environments, different formats, and I haven't seen a single document that has, for example, gone into the wrong patient file or been allocated to the wrong doctor. And for me, that tells me that the tool has been built well in terms of the cross-checking and knowing when to say stop. I'm not 100% sure about that date of birth. I'm not sure about that document name. Can you just have a quick check of that? And as you can see, the correction of the ones that it can't automatically import, because it still populates the ones that it can identify, your time save on those documents that still need checking is still massive, because you still don't need to type in, 6 out of the 7 fields. It might just be the one field that needs to be quickly cross-checked, or, maybe have something manually changed in the subject line to match what the GP prefers.
Yeah, look, to your point, I feel like, often I'll say, let's make sure we're allocating the tasks best suited to humans to the humans, and the tasks best suited to the machines. And yeah, I guess if you had somebody in the team who could import documents even more accurately than what the artificial intelligence could do, that person's probably overqualified for that role. You'd probably want to reallocate them to some other even higher value adding activities as well. And I guess from my own experience of any tool, and the cool thing is that this is the worst the technology is ever going to be. That's what people often say about AI. As things continue to improve, it feels like that's the path that we'll be going down in terms of accuracy. It almost feels like it would be, at some point we'll get to a point where it would almost be inappropriate for you not to use some of these tools, because the accuracy and the speed in which it's done is far superior than getting a poor human to clunk it in. So that's super cool. Melvin, to kind of thinking about this and seeing a real specific example, it's great to see that particular process or workflow. That's just one example within a GP workspace. I imagine, though, these types of, I guess, agents or hyper-focused areas of a process can be applied to anywhere in GP land. Tell me, close us out about where you're kind of looking at next in terms of primary care and how this can be applied.
Yeah, as I said, speaking to customers is really important, and to figure out what their real pain points are, and to not solve problems with cool AI that don't exist. Having said that, there do seem to be a number of different problems in the GP admin space. And one of the ones we initially looked at but didn't go forward with was voice appointment booking. Now, I think the technology, the reason we didn't go forward with that was the need wasn't quite as big, but also the technology just wasn't quite good enough at that point at the end of last year. But now, as the technologies become better, we're looking at, okay, what is the next agent alongside Samantha that does allocations or document processing that we can bring to the GP world. And so we'd love to get feedback from other folks, whether it's to do with inbound communications, or whether it's to do with appointment booking, or even billing, or all these other types of problem statements, that we can build another agent to really improve the productivity of the workforce and sort of change the game. So that looking forward, we'd love to get feedback from other folks in GP land to guide us on what to build next.
No, love it. Look, I know you're no stranger to a healthcare meetup, so people can find you there. The details for Care GP will be in the show notes of this episode and on our website too. But I also know you're very big on, I guess, building in public within the THT Plus community as an active member in there too. So there's no shortage of ways for people to get in touch to help you build some of these tools that really address some particular problems. So, Melvin, Vince, I really appreciate you taking us the time to walk us through these challenges that we're addressing, and looking forward to seeing the potential for what's to come. Thank you so much for joining us on the show.
Thanks, Pete. Appreciate it.
Thanks for having us.
We hope you enjoyed this episode of Talking Health Tech. Make sure you like and subscribe, and share this episode with someone who might find it valuable. For more information and resources about healthcare innovation, visit talkinghealthtech.com.